If you're dealing with shin splints, it's typically diagnosable through a subjective and objective exam. You don't typically need imaging to diagnose. Shin splints is a vague, diffuse pain, roughly 5 centimeters on the inside distal portion of that tibia. Of course, it's typically provoked with more activity and it gets better with rest. However, it's important to note, especially with tendon involvement, it might warm up and feel good at the beginning of an activity, only to get worse after prolonged rest. Of course, if shin splints is progressing in the wrong direction, if it's getting worse, it might hurt throughout the duration of a run or at the beginning of a run, as well as at rest. It's important to differentiate between other injuries or other things that might be going on that might look like shin splints, but might not actually be shin splints. For example, a tibial stress fracture is something to look out for. Since shin splints is probably something along the lines of a tendon bone pathology, if it progresses and gets worse, that might progress into a tibial bone stress injury. If this larger, vague, diffuse pain gets more narrow, a smaller region, a little more focal, that might indicate that there is a stress fracture. Chronic exertional compartment syndrome is also something that you may want to be mindful of. Chronic exertional compartment syndrome is distinct from medial tibial stress syndrome or shin splints in that it doesn't necessarily start at the beginning of an exercise, but rather it will initiate at a predictable point in your run. It's also often bilateral, meaning on both sides as opposed to just one side. There also might be some sensation or motor loss and weakness associated with compartment syndrome as well. So if you're dealing with shin splints, it might be a longer, wider region that's vague and diffuse. If it gets sharper and more focal or pinpoint, you may be developing a tibial bone stress injury. Shin splints typically get better at the initiation of a run, but they might reproduce after a prolonged period of rest. Having said that, if they're getting worse, they're going to be painful at the start of an exercise or at rest. If there's any sort of sensation loss or true strength loss, you might not be dealing with shin splints.